Let's explore the anatomy of a C-section using the Primal Pictures downloadable mobile apps. To begin the procedure, the patient is positioned on their back in the supine position with a slight left tilt to reduce any compression on the vena cava. Next, a skin incision is made. One of the commonly used techniques is the fan and steel method, where a curved 10 to 15 centimeter incision is made 2 to 3 centimeters above the pubic symphysis. Next, an incision is made through the subcutaneous tissue and the fascia. The skin, subcutaneous tissue, and the fascia are then retracted along this initial transverse incision, which exposes the underlying musculature. The rectus sheath is dissected off of the rectus abdominis muscle, and now a vertical incision is made along the linea alba, the midline of the rectus abdominis, allowing the muscular layers to be separated along the midline without damaging the muscular tissue itself. The next layer a surgeon would be met with is the parietal peritoneum. A surgeon may use a technique known as tenting, where the peritoneum is pulled upwards and a small incision is made. Then a blunt dissection is performed to avoid damaging any of the underlying structures. A retractor is inserted to expose the lower segment of the uterus. The vesicouterine peritoneum is grasped with forceps and then incised to create a bladder flap. This vesicouterine peritoneum covers the uterus anteriorly and the bladder posteriorly. The bladder is then dissected off of the lower uterine segment. To deliver the baby, the surgeon inserts their hands into the uterine cavity, lifting the fetal head into the incision and through the previous retracted layers.